Fever is always an emergency in newborns. Does anyone know what a fever is? What number we look for? It's 100.4 is what's called is what we consider a fever. And the best way to take a temperature, anyone know? Rectally. Yeah, rectally. So the armpit one can be off by a degree, and I know there's a whole old wives' tale of adding a degree if you take it under the armpit, but that's actually not accurate. Sometimes the armpit can actually be 100% accurate, and sometimes it can be off by more than a degree. So if you think that this does not mean that you go around checking your baby's temperature all the time. If the baby looks sick, if you feel them warm, if they're just not acting themselves, I'll usually say, you know what, take a rectal temperature just to make sure. So anything over 100.4, if your baby's under 2 months old, they do need to go to the hospital, and they will get admitted to the hospital. So number 2, forceful vomiting. Sometimes when you burp your baby, they're gonna spit up a little bit. That's completely normal. Forceful vomiting is if it's shooting across the room. So that we call it projectile vomiting. It shoots across. That's not normal. If they do it more than once, I usually say, you know what, we need to see the baby. Sometimes they need an ultrasound of their stomach to see if there's something wrong with one of the muscles that connects your stomach to your intestines. If a baby has a cough, we also want to see this baby because that's also not normal. They might cough once in a day, that's okay. Sneezing is normal, hiccuping, stuffy noses might be normal. When babies are born, they might sound like kind of like that sound. That can be normal, but if the baby starts coughing, we definitely want to see them. If any problems feeding, if your baby is too sleepy and won't feed, or if they're too cranky, fussy, and won't feed, we're usually going to want to see the baby as well. And then, of course, if they're sleeping just way too much, because Dr. Valentine will talk a little bit about the feeding patterns, but if they're sleeping a lot where you're constantly having to wake them up to feed, that's usually a little concerning to us, or obviously if they're jaundiced. So these are things that you're going to hear us say over. We're going to tell you this at the hospital. We're going to tell you this at their first visit again. Some of the things people are asking me, what should I have at home? Saline nasal spray, there's always going to be at some point in your life where you're going to use saline nasal spray when the baby has a cold, if the baby seems congested. It's completely natural, just salt water helps take out some of the mucus. A bulb suction, you don't necessarily have to get it because they typically do give it to you at the hospital, but sometimes when they spit up, you want to get in the mouth and suck out some of the stuff that's in there. Rectal thermometer, for sure, make sure that you have that because you don't want it to be 2 in the morning when you're running out to CVS trying to get a thermometer, which I've done before. And cool mist humidifier is a good thing to have if the baby has a cold. There's almost no medications you can use for babies when they have a cold, so having a humidifier and saline is probably what your pediatrician is going to tell you to use. Like I said, Vaseline is my go-to thing for skin, for dry skin, for diaper rashes. It really does help. It's good to have at least 1 tube of diaper cream, again, so you don't have to run out at 2 in the morning to get it. And then hand sanitizer, because everyone that wants to stick their hand, their finger in that little cute hand, you gotta be like, okay, let me squirt you with some hand sanitizer.